empty without that dreaded copay. 888-539-2980 is the number to call. That's 888-539-2980. The American College of Emergency Room Physicians gave their annual report on where they think their part of the medical industry is. They gave the nation an overall grade of D+, which is barely a pass. We in California, we did a little bit better. We got a C-, but we got an F for access to emergency care. Mainly because when you get to an ER, it takes, on average, 5 hours to get to see the emergency room doctor. I mean, that's really unacceptable. The other thing they were concerned about was in a state prone to earthquakes and natural disasters like fires, we don't have an overall plan. On the good side, in serious trauma, no Californian is more than 60 minutes from a big, major trauma center. Now that's pretty good. So we need to clap ourselves on the back about that. But what I want to emphasize here is that not all emergency rooms are equal. And you need to know which ones are which. You need to know, in an emergency, where do I go? Now, if you call 911, the ambulance, the paramedics will decide where you're going to go. They'll touch the base and they'll say, hey, we've got blah, 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 and they'll direct them to the right emergency room. Or they'll direct them to the emergency room that's open. Open means they have enough doctors and support staff and they have a bed and they can take care of you. Because even if the center is fully equipped, if they're overwhelmed, if they've got too many patients, guess what? They can't take care of you. So what do you need to know about your local emergency rooms? You need to know, first off, which one is covered by your insurance. Now, any emergency room will see you, any emergency room will treat you, but your bill will be bigger if you go to the wrong one. So you've got a sprained ankle and you go to the wrong emergency room, your bill could be bigger. Bigger in the sense that the doctor who reads the x-ray for you is out of network, so your bill's going to be bigger. So you need to know which one is covered by your insurance. You can either call your insurance company or check with your doctor. And this is especially important if you have a HMO, because they've got deals with a local emergency room, and that's the one you should be going to. You also need to know, can they handle a heart attack? Do they have the equipment on? Do they have access to high-powered cardiologists who can come in and do what's necessary? If you're having a stroke, are they part of the stroke program? Can they get you a scan within an hour and get you the right treatment? Not every emergency room is equipped like that. Can they handle trauma? Where should you go? Some years ago, I was sick myself, and I went to a local emergency room. And I did not tell them I was a doctor. Big mistake. Big mistake. It's like 2 in the morning, I'm in agony, I'm rolled over, doubled up in pain. And for the first time in my life, I had a shot of morphine. Magically, the pain went. Magically, it was just gone. He did some x-rays, plain x-rays of my abdomen, which are about as useful as, 1950s technology. He did some blood work. And they came to give me the diagnosis. And he said to me, you've got some constipation and your liver's inflamed, you've got hepatitis. I go, really? You think I was doubled over in pain because I was constipated? He said, yeah. I said, really? You thought I was... I said, I haven't been in an emergency room since I was 5 as a patient. That's over 40 years ago. And, he was young and inexperienced, and that's what we call in the trade a lifeline. That's what you tell somebody, you know what? I haven't been here for 40 years. There must be something really wrong. And he didn't take the lifeline. He didn't recognize it. So at that point, my pain is gone. I wrote him off. I wrote him off as useless. And the next day, I go to see a gastroenterologist. I get a workup. It's a long story. Of course, I had gallstone disease, right? Inflamed liver, right upper quadrant pain, doubled over, middle-aged guy, hasn't been in an ER as a patient for 40 years. He didn't even pick up on the as a patient bit. So what I'm trying to get across with this story is that ER docs are like you or me. They're not always right. So you have to be aware of that. You have to understand all of that. So when you figure out which emergency room you should go to, what about when you should not go to the emergency room? What about those moments? For instance, if you got a flu-like illness, why are you going to an emergency room? Go to urgent care. And most of these urgent cares nowadays are open till 9 or 10 o'clock at night. So don't suddenly decide at a minute to 10, I'm going to go to the urgent care and get there and it's closed and say, hey, I'll go to the emergency room. Why not? Because it's expensive. And you're blocking it up and there's no need for you to be there. Come on, think about it. Or where you sprain your ankle, urgent care, they can do your x-ray for you. Lacerations, by and large, urgent care can do that. You need a drug refill? Are you going to line up for 5 hours in the emergency room? Really? You think that doesn't happen? It happens all the time. So you need to go to your doc and say to him, okay, so what happens after hours? What happens if I need a drug refill and you're not available? Where can I go? What do you have open for me on Saturday and Sunday? Do you have a doctor on call that I can call her and say, I've got a problem, what should I do? You've got all of those things in there. And you should take advantage of them. Because that's one of the reasons that it takes 5 hours to see an ER doc. Because there's quite a few people in there who shouldn't be there. Who could be dealing with their regular doctor. And of course, in disasters, who should go to an emergency room? Whoever needs to go. But not everybody needs to go. If you just injured your ankle, you can go to an urgent care and get them to look after it. I'm not suggesting that you triage yourself in a disaster and say, well, I don't need to go. But be sensible about it. If the only part of you that's hurting, the only part of you that's injured is your ankle and it's swollen and you can't walk, go to the urgent care. They'll x-ray to put in a splint and all those kind of things, whatever it is that you need to do. My final thoughts on this I want to explain to you is the politics of an emergency room. As I've already said earlier, ERs are expensive. And when you see an ER doc, generally speaking, they'll do every test in the book. Sometimes when I follow up on patients, I refer it and I go, really? You did how many scans on this 94-year-old woman? You had to do that? But they do, because that's who they are. So, when you see a doctor in the emergency room, she'll order all the tests and many more that you need. She'll refer, if she thinks you need to be admitted, she'll call a hospitalist for your group. A hospitalist is a doctor who works just in the hospital, who manages inpatients, and then hopefully manages them when they're being discharged so they don't bounce back into the hospital. Now, one of the dirty little secrets that not a lot of people know is that some hospitals are getting bonuses now for not admitting patients. Yeah, you heard me right. They get extra money, they get a bonus if they don't admit you. If they figure out how not to admit you. That's even true with Medicare patients. Right? So, you got to think about that when you're there. And you got to be assertive, not aggressive, assertive. So that if you think you need to be admitted because you're so short of breath or this or that, or you don't feel that your doctor will be available in 12 hours to pick up the ball, you need to be assertive about that. Now, when you go to an emergency room, generally speaking, they don't know you. Or hopefully they don't know you, that you're not a frequent flyer. But if they don't know you, you should ask them if there's any doubt about what's going on, if you've got any kind of unusual illness, to contact your regular doctor. And often what I tell patients is, when you go into the emergency room and you've got something unusual, say you've got Addison's disease, whatever it is. Addison's disease when your adrenals aren't working right, so you don't get that surge in cortisol that you need when you're in the stress, when you have an infection, whatever. Maybe you just need to contact your endocrinologist or your specialist and let them know, I'm on the way into the emergency room because of. And they can contact the emergency room doctor and let them know that their patient is going in and what the special needs of that patient are. Because, as I've clearly stated throughout this, emergency rooms are busy. They're overwhelmed at times. Those docs have an awful lot of stuff going on. And they prioritize, they triage. They choose where to spend their time and where not to spend their time. And remember what their goal is. Their goal is to stabilize you, admit you, or turf you out and send you on back to your primary care doctor or back to your specialist. They're not there to do everything definitive That's the take-home message. 888-539-2980 is the number to call. And remember, you don't have to call in and talk about what I'm talking about. You can talk about what you want to talk about, whatever is on your mind about your health or your family's health. Maybe you've had a new diagnosis. Maybe you're worried about the side effects of a drug. I don't know. I won't know till you call. 888-539-2980. When I come back, I want to talk a little bit about all kinds of stuff about falling asleep and how difficult it is, that $30 billion business, all kinds of